Well, what are some rare complications? Infection is a rare complication, but it can be a serious one. I'm happy to say that in 70,000 LASIK procedures, I've not had one case of even the most mild infection postoperatively, and I believe it's in part because we have a very strict preoperative infection control regimen consisting of the eyelid scrubs for a week prior to surgery, antibiotic drops for 3 days prior to surgery, and intraoperatively, we use antibiotic drops and carefully prepare the eye with iodine solution. But what if an infection occurs? This can be potentially serious and can cause severe scarring on the surface of the eye, such that the patient's obligated to use full-time hard contact lenses in order to achieve the very best vision, or in the most unusual case, to undergo a corneal transplant operation in order to achieve your best vision. Again, in over 70,000 cases, I've not had one case of an infection. Now, another exceedingly rare complication is the closure of a blood vessel in the back of the eye, such that it starves the retina for oxygen for a few moments and can result in the loss of vision. Now, not only have I not had a case of this, I've never even heard of a case of this, but it's theoretically possible, and I want you to be aware of it. However, it's important to realize that this is exceedingly rare. Now, what about a condition called keratoconus, or post-LASIK ectasia? Now, keratoconus is an unusual but a naturally occurring thinning disorder of the cornea, where the cornea becomes very steep and thin and protrudes. Although far from a perfect example, picture an ice cream cone. Now, the curvature of most people's cornea is similar to the scoop of the ice cream, whereas patients with keratoconus have a cornea that's shaped a little bit more like the tip of the ice cream cone. This condition generally starts in the teens and progresses throughout the 20s. Preoperatively, we do sophisticated mapping techniques in order to detect the earliest forms of keratoconus. Obviously, if we detect keratoconus, we won't be able to do your LASIK, because LASIK can significantly exacerbate underlying keratoconus. And sometimes patients may have the potential to develop keratoconus, but we cannot yet detect it with any kind of our scanning techniques. So we would perform the laser procedure, and within a year or two, a patient may develop keratoconus. That is, in some cases, we may actually precipitate keratoconus with the LASIK procedure. In this case, it's known as post-LASIK ectasia. In some cases, it may have developed anyway, whether we did the LASIK or not, but it's very hard to tell the difference. Now, if this occurs, and it is rare, you're actually in the best of hands, as I am a corneal transplant and keratoconus specialist, well-trained and experienced in the recognition and treatment of keratoconus and post-LASIK ectasia. Additionally, we have the latest diagnostic equipment in order to detect keratoconus and determine whether you have underlying keratoconus and whether it would be safe to proceed with LASIK. Now, if keratoconus or post-LASIK ectasia develops after your LASIK surgery, it may be necessary to undergo corneal collagen cross-linking, or have further surgery with the placement of plastic ring segments called intacts, or wear a specialized scleral contact lens in order to achieve your very best vision. In some cases, the ectasia may become so severe that the patient actually requires a corneal transplant operation to restore decent vision.